Hi, we're students from North Carolina Central University Department of Nursing. Did you know that nearly half of all adults in the United States have high blood pressure, but sadly, only half of those have it under control?
Men and African Americans are more likely to have high blood pressure than women or any other racial or ethnic group.
That's why keeping an eye on your blood pressure at home is important. Today, we're going to show you how to check your blood pressure, when to call your provider, and provide tips on how to manage your blood pressure at home.
Good morning, Miss Dana. My name is Tina Scott, and I'm a home health nurse, and your doctor wanted me to come out today to check your blood pressure.
Yes, ma'am.
He was a little concerned about your numbers. They looked a little high when you were in the doctor's office, so we're trying to monitor your blood pressure just to make sure that if you need to prescribe some medications for you. We're going to talk a little bit to you today about hypertension. Just want to make sure you're safe. How are you doing today?
I feel okay today. I'm a little nervous. We told me my blood pressure was high, so I'm very glad you're here.
Okay. Well, I'm going to go over showing you how to use a blood pressure monitor.
Okay.
We have your blood pressure monitor here today, and I'm going to go ahead and leave this one with you. So what I'll do is go over how to put your blood pressure cuff on. We'll talk about your blood pressure reading and just give you a brief description on what that means. And then we'll just go from there. If you have any other questions, we'll talk to you about your questions after we finish the demonstration of how to put your blood pressure cuff on.
Okay, that sounds good.
Do you have any questions?
No, I'm just ready to learn about this because it scares me.
Right, and I do understand that. That's why I wanted to come out today so that I can show you how to monitor your blood pressure. First, I would like for you to go ahead and take your sweater off.
Okay.
So we want to make sure you don't have any restrictive clothing on your arm, because anything too tight on the arm can really give you an exaggerated blood pressure reading.
Okay.
So I want you to sit back in your chair.
Okay.
I want you to relax. Oftentimes I tell my clients, go to the beach, go somewhere where you're on vacation so that you can just try to relax. Because if not, you're going to really give yourself an exaggerated blood pressure reading. So let's just go ahead and relax yourself. Sit back in your chair, Miss Dana.
Okay.
Make sure your feet are flat on the floor. We don't want your legs crossed. That also can interfere with your blood pressure reading. Great. All right. So we also want to make sure, and I have you a nice blood pressure cuff today to fit your arm. This button right here will turn your monitor on. We have your memory button here, and I already have it set with your date and time. Those things are very critical because once we do your blood pressure, I'm going to show you how to record your readings inside of your book here. Timing is always critical. So I want you to try to take your blood pressure the same time each day. And I want you somewhere quiet, sitting down at a table. If you can do it here at this table, that's great. Make sure your arm is resting before you take your pressure, and then you'll put it inside of your book, and then take it maybe later in the afternoon.
Okay.
But make sure you do rest before you take your blood pressure, okay? So first of all, you see this little mark here. That's very good to have on here. So you'll make sure you want to have this mark in here right in the center point of your arm here, okay? So let's go ahead and slide this on. Has some nice little Velcro there, okay? And we'll go ahead and get that on nice and snug. Now I want to make sure I don't have it too tight, because you don't want it to be too tight, because if it's too tight, you're going to give yourself an exaggerated reading. So let's go ahead and relax that arm for me there. Okay, good. Rest your shoulders. All right, we'll bring that up here, and we'll just hit this button here, and it should start reading for us. We'll get a little tight. Are you okay? Okay, we have your reading. Are you okay? Is your blood pressure?
I'm a little nervous.
I can tell you're a little nervous. Now, did you take your blood pressure medicine this morning?
Well, I was trying to get dressed and I knew you were coming, so I kind of forgot to take it.
Okay, so that's one thing we'll have to talk about.
Okay.
You need to take your blood pressure medicine, okay?
Okay.
But if you look here on your machine, you'll see your top number here is 194. That's what we call the systolic number. So that top number is really high. We really want it a little bit lower. And that bottom number, it looks like it was like at 96. So we're high on the bottom as well, which we call that your diastolic.
Okay.
So I'm a little concerned about that today. So I want you to just sit here and just relax for me, okay? All right, and I'm gonna just talk a little bit more about how I want you to record your blood pressure. Okay, so in here, you'll see you have your date. We will put today's date there. The time is right here on your monitor, which is very critical. And also you'll put your top number, your systolic number here, and your diastolic number there. And if you notice right here in the bottom, that was your pulse. It was at 86.
Okay.
So you'll put that there, and your pulse is fine today.
Okay.
Okay? All right. So it's very, very critical that we keep an eye on your blood pressure. This is why the doctor wants you to start monitoring your blood pressure, because we got to really see what's going on. If your medication is working, that's when you take it, or if it's not, he needs to increase it.
Okay.
Okay? Any other questions?
No, I remember to take my blood pressure twice a day, the same time every day, if I remember, and then write it down, and then make sure I take my medicine. Do I take this to the doctor?
Yes, you will take this to the doctor when you go back in 2 weeks. And as you can see, you can put your date, the time, that top number that I was telling you about, which is your systolic number, you put it there. That bottom number, you'll put that there, which is your diastolic, and make sure you put your pulse as well.
Okay.
I want you to continue doing those things, all right?
Okay,
Because
I
those
can do
things
that.
are very helpful and also assisting your body to get back to a place of a healthy blood pressure, okay?
Okay.
All right, because you really want to take the stress off these organs, especially your kidneys, your heart, and even your brain,
Okay.
okay?
Monitoring your blood pressure at home is important for your health and easy to do. You can buy an automatic blood pressure cuff for yourself online or at a drugstore or medical supply store, and you don't need a prescription. We recommend that you buy an automatic cuff that goes around your upper arm and not a cuff designed for your wrist because they are not as accurate. It is a good idea to bring your cuff to your provider's office so they can test it against their blood pressure monitors for accuracy. Your blood pressure is based on your systolic and diastolic pressures. The top number is systolic pressure. This is how much pressure blood puts on your vessels when your heart beats. The bottom number, the diastolic pressure, is how much pressure stays in your vessels when your heart is resting between beats. When blood pressure is not controlled, it can lead to heart disease, heart attack or heart failure, stroke, and problems with the kidneys and eyes. You should call your provider if your blood pressure becomes higher than 180/120 or either number increases by more than 30 from your normal blood pressure, even if you don't have symptoms. Your provider will let you know what to do, and you may need to go to the emergency room if your blood pressure is very high. Your blood pressure may change slightly depending on your stress, your activity levels, and what you have recently eaten. Let your provider know if there are consistent changes in your blood pressure. That means if your blood pressure is either higher or lower for at least 2 days in a row. You should use a notebook or digital document to keep track of your blood pressures each day. It is important to notice when you have changes from your baseline or normal blood pressure so that you and your doctor can tell if your blood pressure is rising or staying the same. Monitoring your blood pressure at home is easy and important. Healthy blood pressure is considered 120/80, but your provider will tailor your blood pressure goals based on your overall health.
Remember to contact your provider if your blood pressure is higher than 180/120 or if either number increases by more than 30 from your normal blood pressure.
Check your blood pressure if you have symptoms of hypertension and let your provider know if it is higher than normal.
High blood pressure can be scary, but there is a lot that you and your provider can do to take care of it. Quitting or reducing smoking and drinking, exercising more, eating healthier food, and reducing stress can all help.
If you are prescribed medicine to lower your blood pressure, you should take the medicine as directed and at the same time every day. It is normal to feel a little dizzy when starting a blood pressure medication, so be careful to avoid falls and injuries.
Remember, you and your provider are a team working together to keep your blood pressure and your body healthy.